Picture this. You haven't seen a doctor in years. It has taken 3 months to get an appointment with a primary care doctor. Now, you're sitting in a waiting room for over an hour. You finally get to meet your new doctor. However, your doctor seems rushed and is hurriedly typing in front of a computer screen instead of making eye contact with you. You leave the office paying an unclear copay and wondering if your doctor will ever remember you or your concerns. Sound unpleasantly familiar? Well, what if I told you things could be different? What if you could walk into your doctor's office and get this? Be seen at the actual time of your scheduled appointment. What if you could get all your questions addressed in a comprehensive 60-minute visit? What if you could call or text your doctor directly about an urgent question instead of going through 4 other office staff members? And what if all this could be done for anyone without having some Cadillac insurance plan or paying an outrageous annual concierge fee? Sounds too good to be true, right? Well, it's not. Welcome to direct primary care. I am part of a group of doctors that make up less than 1% of physicians in the nation. Our practice model is known as direct primary care, or DPC for short, and it is an innovative healthcare model that eliminates health insurance for primary care needs. To better understand direct primary care, let's talk about our current healthcare system first. The United States spends more on healthcare than any other nation, making it have the most expensive healthcare system in the world. US healthcare spending reached $4.1 trillion in 2020. And every year, healthcare spending is increasing, but despite this, the United States has one of the poorest access and health outcomes compared to other wealthy nations. The same can be said about our health insurance industry. Every year, monthly insurance premiums are increasing. So you would think the quality of care is also improving, right? But is this true? Is having more expensive health insurance equivalent to better healthcare and patient experience? Unfortunately, the two couldn't be more disconnected. Let me explain. When I was in a traditional insurance-based practice, I saw Jane Doe, a 55-year-old female who had injured her right shoulder. Before she came to see me, she tried ice, rest, over-the-counter pain medications, and even some stretching exercises to alleviate her pain. However, her pain persisted, so she finally came to see me because she developed weakness in her right arm. After a quick exam, I determined she needed an MRI to evaluate for a possible tear in her shoulder. So, you would think I could just order the MRI and send her on her way to get it done, right? Wrong. You see, the number of steps required to order an MRI is just one of the reasons our healthcare system is so complicated and time-consuming. This is how it works. I place an order for the MRI in the computer system, and someone faxes that order to the imaging center. A person from the patient's insurance company then faxes me a document to fill out more information to justify the need for the MRI. After faxing that document back to the insurance company, sometimes I still need to get on the phone to do a doctor-to-doctor call with another physician between seeing patients to justify the need for the MRI yet again. As you can see, there are several unnecessary steps just to order one test for one patient. And in the end, more time is wasted for the patient and for the physician. So how would this patient's condition be managed differently with DPC? In my DPC practice, this same patient would be seen right away and would have an hour of time with me to evaluate her shoulder. Her appointment would be with me, her doctor, not another mid-level provider. I can bypass health insurance hurdles and save the patient money by finding an imaging center in town that can do that same MRI for $250, which is a fraction of the price that would be billed to the patient's health insurance. And all of this can be done quicker with less unnecessary forms and justifications. This is how it works in my DPC practice. I place an order for the MRI, and that order gets faxed to an imaging center. The imaging center reaches out to the patient directly to schedule the appointment for the MRI, and the patient only pays $250. With DPC, I have ample time to listen to my patients and be their trusted ally. I have time to counsel them about their health. I have time to search for lower cost testing and medications. With all these benefits, patient satisfaction improves, and the doctor's primary focus remains on the patient. I have another personal example that I'd like to share. My husband, who is an emergency medicine physician, fell ill to COVID in 2020. He was out of work for several weeks, but fortunately, he didn't need to be hospitalized. Now, this is only because we are both in the healthcare fields and we knew what to use for symptomatic treatment. However, the shock of contracting COVID in a young, healthy individual was only followed by the shock of our medical bills. Although we may have saved a few hundreds of dollars by not having office visits with an internist, and saved a few thousands of dollars by not having ER visits, our medical expenses were still very surprising. For our traditional health insurance plan, we were paying $1,800 a month for a family of 4. My husband's lab testing was $500, his CT scan was $950, and there was a separate radiologist reading fee of $275. His medications cost $100, and that was with the use of some coupons we found online. We didn't have any office visit copays, but even without that added cost, our total monthly expenses that month were over $3,600. Ouch. The pain from those medical bills was almost as painful as having COVID. If we were part of a DPC practice, our catastrophic insurance plan would be $500 for a family of 4. My husband's DPC membership would be $100. His lab testing would be $75 with direct pricing with his PCP. His CT scan would only be $250, and his medications would be $50 purchased directly from his PCP's office. There would be no copays for unlimited visits with his DPC doctor, and our monthly expenses would be significantly reduced to $975. These two examples show how health insurance adds a lot of time and cost to a patient's experience with the healthcare system. Interestingly, health insurance was originally set out to cover only expensive healthcare costs. However, over the years, this has completely changed. Health insurance should be used like other insurances, such as car insurance. You use your car insurance to pay for car accidents, not for general oil maintenance or rotation of your tires. In the same way, health insurance should be used for emergencies, surgeries, and hospitalization, which are much more costly. Primary care, on the other hand, is the least expensive, but arguably the most important healthcare service because it requires a meaningful patient-doctor relationship. In my DPC practice, patients can have health insurance, but they reserve it for more costly services rather than primary care needs. Unfortunately, the current insurance-based practice model places too many restrictions, thereby becoming a barrier to that patient-doctor relationship. Emphasis is placed on the number of patients seen rather than the time spent with patients. Emphasis is placed on the number of boxes clicked for insurance reimbursement rather than addressing the patient's list of concerns. Emphasis is placed on how sick a patient appears on paper rather than guiding patients to better health. DPC is a simplified membership-based payment model for primary care services. Simply put, DPC is like a gym membership. For a monthly fee, patients can contact me or see me as many times as they need, whether it's in the office, via a virtual visit, a phone call, email, or text. I mean, who wouldn't love to have their doctor's personal phone number, right? And this monthly fee is less than $127, which was the average monthly cell phone bill in the United States last year. More importantly, patients can see me without any copays, they can obtain laboratory tests at discounted rates, and they can purchase many prescription medications in the office at a fraction of retail prices. Instead of paying $50 for a single blood test, my patients can get a full panel of blood work done for less than $50 total. There are no hidden fees and no insurance is billed. Now, I'm not blaming the doctors who work in the traditional insurance-based practices. I've been in their shoes for years, and I understand the challenges they face. They're trying to balance their oath to provide quality patient care with the endless paperwork of the insurance industry. Unfortunately, this balance can't be achieved when we're seeing more than 20 patients a day. I could not achieve this balance, so I made a change and I broke away from the confines of the insurance companies. Change is not easy, nor is it comfortable. I had to become uncomfortable and leave the traditional insurance-based model that I already knew very well and start something innovative and new called direct primary care. Direct primary care revives that faith and trust that patients and physicians once used to have in each other. It has saved my career and has inspired me to fulfill the Hippocratic oath I took for my patients. My patients have a trusted doctor who treats them like family instead of just another number. Perhaps you're in the process of finding a new compassionate doctor. Or maybe you're tired of insurance companies dictating which doctor you can see or which medications you can take. Or maybe you just want a reliable doctor who's available and affordable. There are several DPC doctors around the nation who have practices just like mine, and we are all motivated to work for you, no matter if you're just entering adulthood or enjoying retirement. It doesn't matter if you have one medical condition or 15 chronic conditions. Whether you have health insurance or not, I want you to remember that direct primary care is an option for you, and you can be a part of this dynamic change to revive those old school patient-doctor relationships. Thank you.